Today, we have the honor of hosting Dr. Ramina Panjwani, a trailblazing female functional medicine physician with a remarkable story. From her humble beginnings in an immigrant family to serving in Iraq with the Air Force, Dr. Ramina has broken barriers and forged her own path. She combines her extensive medical expertise with a passion for holistic wellness, emphasizing the mind body connection. Join us as we dive into her journey, explore the principles of functional medicine, and uncover practical strategies for achieving optimal health and well being. Get ready for an inspiring conversation that will leave you empowered to take control over your health and your life. Hey, Dr. Ramina, welcome to Life Without Secrets.
It froze. Can you hear me? Jillian, hello.
Hello. You know what? Did it freeze? Can you hear me?
Okay, we're good now.
Okay,
Now
I
I can.
think we
Yes,
froze there for a moment. So, welcome to Life Without Secrets.
Thank you for having me. I am so excited to jump in and have an amazing episode and conversation.
I am too. I'm so excited to have you on here. I feel like we share so many similar passions, and this is going to just be a really great conversation from your perspective and mine. But to start, I want to kind of let everybody in on you and your journey, which is so powerful from coming from an immigrant family to becoming a board certified internal medicine physician who specializes now in functional medicine. It's also inspiring. So, can you kind of share about your early years and what motivated you to pursue higher education and a career in medicine?
Yeah, so my journey started way back. Of course, my parents came to the States to provide a better future for my brother and myself, but they didn't really understand what that entailed, right? At that time, it was just survival
Mm-hmm.
to food on the table and just make it through the day working odd end jobs. So I wanted something different. I wanted to change the trajectory, not only for the current family, and then of course my future uh, babies, which I have now. But I would say what my journey started with that hardship, but I decided to go ahead and choose joining the Air Force as a mechanism to not only provide the funds to have a future in education, but also to instill the confidence, right? I mean, I was young, I was 18, I didn't know what I was doing, and I didn't really know what education was about, higher education, I should say. And my parents, being also South Asian, it was not necessarily pushed upon to go get an education. They were just like, oh, just go get married and have babies. And I was like, no, not having it. A little
Mm-hmm.
rebellious. But, and that's part of why taking that path was quite different. It was non traditional, and I was
Mm-hmm.
breaking the glass ceiling in that sense. So it was actually the moment I was in Iraq and we were in the war zone. And I remember there was a set of explosions, saying it nonchalantly, but it just, it was quite impactful because it was in that moment where I realized that life is too short, right? And if I wanted to pursue something, I need to not only get out of my way, my own head, but shut down what, society was trying to push me towards, even including family, even though they mean well. But I decided at that moment, you know what? I'm just going to go for it. I never was told, hey, you could do anything and be anything you want, because it was just not even conceivable, right? We were survival. So I, at that moment, decided to commit that I'm going to make myself stronger. I'm going to get all the knowledge and the tools possible to make myself be a doctor, because I knew that's what I wanted to do. So I did. I went, came back after getting deployed, got the resources, mentors, pushed along. Few years later, get into UT Austin, pursue a degree in nutrition, because I've always been in health and wellness in that sense. And then, of course, getting into med school, pushing through that, residency in internal medicine. And then fast forward, we're in COVID. So get my first real job as ending, free, gonna go save the world and lives, and there's COVID, right? Like, what is that? We didn't even imagine that would be possible in our lifetime, right? And everyone was going through their own dilemmas. Healthcare system was just on the brick of breaking. In fact, it's probably broken, right? You could see the beast of what medicine is. Yes, everything is okay for the bandage approach, and you could see that during COVID, but you could also see how it wasn't it brought out what was deficient in a sense, not only in
Yeah.
the hospital system, in the healthcare system, but also in health in general, in people.
Yeah.
So, with that being said, of course, for the most part, people were just getting burnt out. Healthcare workers, we were all getting burnt out. And that contributed to really soul searching. Why did I go into medicine, right? I went in to save lives, to make an impact, and not just be a slave to the system, honestly. That's what it was. You're just working for a hospital system and really getting nowhere.
Mhm.
So that's where I dug deep in. My my calling was functional medicine. How I came back about that is I am a true believer of not just treating symptoms. The human body is so complex, right? We're not
Yeah.
just a body of organs, we're mind, body, spirit. And the influence of lifestyle, where you could just focus on adjusting and then personalizing it, right? Because everyone is unique. That's what drives me. That's what drove me to get additional certification. And so I went for it. I got the Institute of Functional Medicine through the Cleveland Clinic. And once I got that, then I was at a point, well, now what do I do? There's not going to be a perfect job. So I just decided to create my own brand. Just make it, right? Why do I have to
Yeah.
go find what's out there? Just make it. That's why when you're in that entrepreneurial spirit, you find your calling. It's just the motion keeps going. So that's what I did. I started with a concierge virtual practice, and then from there it expanded, where not only is just seeing the patients there, but also bringing my wellness workshop. So that gives me the opportunity to partner with like-minded businesses, empowering the community and certain populations, and bringing wellness to where it is achievable and it's personalized. So that was one way. And then, of course, just
Yeah.
continuing onwards to spread the message of functional medicine and
Yeah.
wellness.
I love that so much. And I think it's something that is just so needed. Like you said, COVID, really highlighted what was wrong with the system as well. And I think, though, it was a very stressful time. And I think that as a society, we were already stressed, with the way the world was going and moving at such a fast rate. And then I think with COVID, it took a pause, but it didn't help with the stress factor, because we heard about all the negative things that were going on, right? And like for me, I have to be honest, I didn't feel like the ER was, and this was obviously different for depending on where you were in the world and where you worked. But for me, I didn't feel like it was like the busiest time in the hospital, like where I was working in the ER. However, it was a time of stress, right? Like where there was a lot of unknowns for people in society, in the healthcare system, which I think further elevated the stress in the population that obviously affects everything else. So I love that you really focus on the person as a unique individual, how you are focusing on mind, body, and spirit. Can you explain for people that don't know or maybe have never even heard of functional medicine? What is functional medicine, and how does that differ from conventional medicine, like that you do in the hospital?
Yeah, and that's such a common area where I love to educate on. So, comparing conventional medicine and think about going to your regular doctor, your primary care doctor, and also in the hospital. It's symptoms based. You have a diagnosis, right? So, you think it's the diagnosis of, I don't know, fatigue or just, stomach pain. Okay, well, that's
Hmm.
just a symptom. So, we're going to throw medicine at it. Maybe you might, if needed, get an additional consultation from a GI doctor and maybe get a scope and everything is fine, then with that everything being fine, and I say that with quotations, fine, you may get thrown
Yeah.
even more medications and then onward. So the functional medicine approach in that example is not just bandage approach. It's not just symptoms. You're going to explore everything to get to root cause. It's a root cause approach. That's just one, right? It's not just medicine. Yes, it's there if you need it, but what's contributing? Did you look at your lifestyle, right? Are you stressed? How are you sleeping? What are you eating? Are you exercising? What's your mind, body, spirit? Because all that ties into the stress response and affects the entire body. So that's just one example. It's symptoms based for conventional medicine. Now, of course, in the acute setting, which you and I both know and talk about, it's important to put a bandage on a heart attack or a stroke, whatever is acutely needed,
Yeah.
but not in the long-term setting, not in the true prevention setting to thrive and be optimal, to live in your hundreds and be functional, right?
Mm-hmm.
So that is a different approach. You're not just putting the fire out. Then to go even further, when you look at labs, everything is standard. Patients are treated standard. Everyone gets the same treatment, same protocol.
Mm-hmm.
Diabetes, same
Mm-hmm.
protocol.
Yep.
Abdominal pain, same protocol. And you can kind of like go off with the diagnosis. Functional medicine, on the other hand, it is science backed. It's based on so many decades of research, and it takes a personalized approach, including the lifestyle. So even if you take a look at diabetes, the guidelines, the first line approach guidelines suggest for diabetes as well as high blood pressure and high lipids, cholesterol, it's lifestyle. But what does lifestyle truly mean, right? So until you take a deep dive into personalizing that, you're still practicing evidence-based medicine and doing it in a way where you're getting to root cause. So that's one approach. And then you look at the labs. You look at conventional labs, it's again standard. So if you look at a typical blood work, if you look at someone who's tired, fatigued, you might get like a blood panel, CBC, BMP, maybe a thyroid, but it's limited. It's not going to break
Mm-hmm.
down the expanded panel. So functional medicine takes an expanded, advanced approach that normal medicine physicians will not pursue. So taking that further, another example I like to use is a lipid panel, right? If you continue having high lipids, despite you're saying you're eating healthy, well, there's so much that is underlying that, right? If you're female, are your hormones, are you perimenopausal, are your hormones off? And if that's the case, then you need to do an expanded panel and an expanded lipid panel. Meaning, when you do regular blood work, you may get HDL, which is the good cholesterol, LDL, which is bad one, and maybe triglycerides. But if you look at the cholesterol molecule, there's so many points in there. And so the functional medicine panel will break down the particle. So what that means is if you look at if you get a pattern of it's the smaller lipid panel patterns, small lipid pattern, which means you're at a higher risk of cardiovascular events, meaning heart attack, stroke, down the line. And how you approach that, it's missed in conventional medicine because you're not expanding. So you target
Yeah.
that specifically based off of the advanced labs. And that's just one picture. And you can go deep on every single layer. And that's, in a nutshell, how you differentiate functional medicine with conventional medicine. And then, of course, that goes even more deeper. That's just the basics of the differentiation between the two most common types of medicine that people practice in the States. But if you even want to go further and be optimal, like biohack, be optimal, that's where functional medicine can also help you get to your goals.
And explain what that means.
Yeah. So you don't necessarily have to have symptoms. You just want to be optimal. So if you look at things that people that live longer, habits, lifestyles, that people who live longer and are functional, they do maximize the way that they eat, the way that they live, everything, right? And so depending on where you are in the decade of life, your body is going to change. It's going to age, right? So your chronological age doesn't necessarily have to reflect your biological age. And what I mean is,
Yeah.
and I'll take women, because we're both women, and say
Mhm.
like by the time you hit your 30s, and men have this too, but let's say in general, by the time you hit your 30s, you start losing muscle mass, right? And so that is something that conventional medicine doesn't emphasize on, right? It's really it is a bandage approach even in prevention, right? For symptoms to show up before you get screened. So if you look at age related sarcopenia, that's a real thing, right? When you age, you lose your muscle mass, then you see the old
Mhm.
frail people, they break a bone, and then that's one of the most common causes of mortality, death, right? And that,
Yeah.
or if not, the quality of life goes down. So if you take a true prevention approach, so in the 30s, you know you're about to lose muscle mass. So if you're a female, then you want to maximize that. Protein, right? Protein synthesis. Protein is the building block for so many things. So if even if you eat, and I love bringing this up for especially women. So if you look at just conventional recommendations, the recommended daily allowance for protein is just zero point 0.8 grams per kilogram of body weight. That's minimal. That is not even to be optimal. That's just there, right? But you don't
Yeah.
want to do that. You want to build because you're already losing muscle, and that ties into um, hormones, that ties into body composition, to mood, brain fog, all that, right? So
Yeah.
that's
Totally.
something simple is so profound, and that's where the biohacking comes in, right? So where you what's recommended to when you need to make more muscle and more protein, the goal, you want to hit at least 1 gram, but to be optimal, there's been studies that show 1.5 to 1.8. So that's looking at 30 grams at least of protein per meal. So think about that, right? As you age,
Yeah.
you need more of a threshold to stimulate muscle, right? And so
Mhm.
that's just most Americans, we're not eating high protein diets, right? We're eating like pancakes, we're eating cereal.
Carbs,
Exactly.
box food.
Exactly.
Yeah.
So if you
Mhm.
know how to target, that goes a long way. And then the type of exercises, right? There's another example. So if you change your exercise regimen to add more resistance training and strength training, that stimulates muscle growth as well. And that keeps your body composition good. It's anti-inflammatory as well. And it helps with hormones. So as you hit perimenopausal age, you are already ready. And that's just a part of it. Now think about, that's just a tweaking of portions of it. Now imagine when you get even deeper with targeting what you eat, how you sleep, and all that, right? So that
Mhm.
is in the beauty of functional medicine and biohacking to truly be optimal.
Yeah, and I think those are so important, and it honestly, like, blows my mind that, like, we have a healthcare system that doesn't, we learn about, like, holistic wellness and treating the individual, and not putting them in a box and all this stuff, like, in school, and then I feel like you get outside of school, and I think there is something that I see, and I would love to hear. I'm just throwing this at you, but
Mhm.
I would love to hear what your thought process on this, because I see a lot of people that we see on a regular basis, or a type of person that is coming in, and um, they're not taking responsibility for your health. And I think, like, as healthcare workers, we see that more and more and more. And I feel like, as a somebody in the healthcare field, I feel like that's almost a cause of a lot of the healthcare system and the workers getting burnt out, is like, we keep slapping these band-aids on, but we don't have control over that person's life and the choices that they make, right? And so, do you have any advice on how we can empower the listener maybe on here today, or empower the patient that is coming in for those band-aids, but they need a really deeper dive into their life and their health as a whole? I know that's
Yeah, and
kind of like
sometimes
a
the
big
hardest part
question.
is getting started. Now, there's this simple quote I like to go back to. It's simple, but it's profound.
Mhm.
So if you don't make time for your health now, you're going to pay for it in probably the last decade of your life.
Yeah.
And so if you think about it, do you really want to spend the last decade of your life for quality in and out of the hospital, right? Death.
Mhm.
It's going to be expensive
Mhm.
too. And then
Yep.
think about if you have an involved family, then the burden will be on the family too. And that's something that is quite difficult. So
Yep.
if you take even small changes, it'll go a long way. So even if those people that have a hard time getting started, think about what's your why? You want to age well, be around for the grandkids, you want to be independent. You want to be independent. You want to get out of the bed, you want to go to the bathroom yourself, right? Like
Mhm.
those are realistic goals that eventually happen as you age, right? So think about your why, think about how you could take advantage of the time you have now of being young. So take one change. If you feel like, even if it's just eating one vegetable a day, eat one vegetable a day. Go outside and walk for like 1 minute, right? It
Mhm.
takes one habit and then expand it, then expand. And every day you just look back, it becomes a habit and it's not a big deal then. The getting started part is there. So, yes, it is in your hands, even though it may seem difficult. And maybe if you're in the hospital and you're debilitated in a certain way, there's still something you could do. In the ICU, I'm sure you've seen this too. In ICU, they still make intubated patients do therapy, right? Because it's shown even some sort of muscle movement preserves it and helps recovery, right? So that even shows you the most sickest of the people in the hospital, they still try to make them mobile. So if you're able to, I say even just try to get up and walk. Go up and down the stairs if you can. Go walk. Just do something. Eat a new vegetable, a new fruit, whatever the case is. Small wins. That's what it
Yeah.
starts with. And that's what will
Yeah.
empower you.
Yeah, I love that advice too, because I think that, when we look at things as a big picture, it can seem really overwhelming, which then I think people go into like, stress mode even further, which, we know really impacts our health and wellness, really. So, I think that as well is another, um, modality of like learning how to manage our stress. And is that something that functional medicine also talks about and deals with?
Sorry, it froze up. Can you repeat that?
Is it cutting out again? We are having some internet issues here. Here we go. So, Dr. Ramina, if you can hear me, I know that, stress management is really also very crucial for our overall health.
I'm going to try to do a different. I'm going to hotspot. Maybe that'll help speed up because it's really freezing up.
Well, and Dr. Amina is in Texas too, and they've been having some terrible storms. So I was actually surprised we got to jump on here today with all of the weather happening. But it looks like it's working at the moment. But I was diving into like stress, right? And like when we look at like big picture things, and we try to do so much at once, it can actually further exacerbate our stress. And so I love that you're talking about doing those little steps at a time, to empower the person and not increase their stress, because that can be another modality to affect our health and well-being. And so the question was, is functional medicine, does it deal with, also like stress and hormones? Okay, we're back. There, we have had some internet difficulties, but we were going into stress. And, Dr. Ramina, you were talking about having those little steps to empower us to take control over our own health and well being. And I was wondering, is stress management something that functional medicine helps with as well? Do they take that into consideration?
Absolutely. These days we are all living in
Mhm.
hustle in a hectic life, right? So we're constantly stressed, whether we're actively stressed in our lifestyle, whether it's at work or we're constantly on social media, we're constantly connected to our phones and all the electronics, all of that is stress. Then if you add in other lifestyle factors like what you eat, if you eat ultra processed
Mhm.
foods, that's also interpreted in your body as stress. So stress in a general term it can wreak havoc on your body. So functional medicine
Mm-hmm.
absolutely considers that. We dive deep into it. And that's one of the amazing advantages of functional medicine, right? So what we would approach stress is, I love to dive into hormones on this and modalities, how you can just practical tips to take home today. So all the listeners, you can start practicing what I like to describe stress as, right? So in a short-term setting, it's protective. It's a fight or flight response, also known as your sympathetic nervous system. And the main hormone there is something called cortisol. And in functional medicine, you can actually measure cortisol and the rest of your advanced panels to see how it's affecting all your body, your entire body. Isn't that amazing? Like just a lab to break down what's happening in
Absolutely.
your biochemistry.
Mm-hmm.
So that's a part of, in the short term, stress is good. In the long term, it can literally burn out your body and those hormones and everything else in your
Mm-hmm.
body. And of course, it affects your mood, your energy level, and so forth. Your sex drive, too. That's important, too. So everything is
Yeah.
affected. What you want to balance is that rest and digest response. The rest and digest is also where you can think clear, creativity, all that flow state comes in. And that's the parasympathetic nervous system. So what happens if you're constantly stressed, whether, again, if it's lifestyle or physically or mentally, whatever the case is, your body doesn't know the difference between physically threatened stress response or if you're interpreting it. So you can
Mm.
modify it, right? Like lifestyle, you could modify that stress response. Number one, like sleep. Sleep is big. You want to make sure sleep
Mm-hmm.
is protective, it regenerates everything, balances it out. Nutrition, of course, you want to try to eat whole foods as much as possible. And then you can make it more complicated if you want, like if you want keto or if you want gluten free. But just in general, as long as you stick to real food, then of course exercise. And here's the kicker. A lot of times people, like for instance, if you're already in a stress state and say you choose to do cardio, that can actually further drive the stress response.
Mm-hmm.
So you want to do
Yep.
modality that decrease that stress response. And I'll talk about that in a second in detail. That's one. And then you look at your relationships. Are you surrounded by toxic relationships that are triggering you? That's triggering that release of cortisol, or are you in
Mm-hmm.
fruitful relationships supported? And then you get into your mind, body, spirit connection, because all that again, we're complex, ties into that stress response. Are you truly safe? Or are you interpreting that you're being chased by a bear? Right? That's stress response.
Yeah.
So that dives into the modality. So then you take those advanced labs that I briefly mentioned, but then you also consider the lifestyle, the modified lifestyle factors. So you could target each of those, but then also the modalities. And I love talking about this because you don't have to make it complicated. The breath. I love starting with
Mm-hmm.
breath work. It's free.
Me too.
It's with you take
Mm-hmm.
it everywhere. And there's something called the vagus nerve in your body. It connects your entire nervous system. And it also connects your gut brain axis,
Mm-hmm.
right? So what you eat, if your gut is on fire, your brain is on fire, and vice versa, right? It's bidirectional. And so, of course, not only what you eat, what you think affects it, but breath work. So if, say, for instance, you're in a stressful situation at work, right? Say you're dealing with a difficult situation, take a deep breath, right? And
Mm-hmm.
something you could take home today and do is simple. There's box breathing, and then there's just, if you can't hold the breath, and I'll walk you all through this. If you can't hold the breath, then there's another one. The idea is you want to take slow inhales, but a longer exhale. And that resets your nervous system. And you'll notice when you take deep breaths, slow down, you can think clearer, your nervous system responds, your heart rate comes down, and so forth. So the box breathing. Picture a box, right? You're taking 4 breaths in, you're holding it for 4 breaths. But of course, people that can't hold it and it elicits a panic response, just don't hold it, just breathe. Then you exhale for 4, hold for 4, exhale for 4, hold for. So you could see that's making a box. The other modality is you could see what works for your body, what feels comfortable. You could take like 4-second breaths in, 5-second breaths in, and then slow exhales of 6-second breaths out. And that's just simple. I'm not even getting into meditation. Like, you don't have to go in a cave and go meditate, right? People, sometimes
Yeah.
it's okay to do that. People want that. But in the hustle of life every day, breathe. Literally, just breathe, right? Like, you look
Mhm.
at, for instance, going to the hospital. When you think about walking into a code situation, what does the person running the code do first? They take a deep breath, they check their own pulse, they check their breath, and then they're clear, they're focused, so they can do what they need to do, right? And that's just
Yep.
one modality that y'all can even start
Mhm.
today. Also,
Yeah.
doing, I love yoga. Yoga, and it doesn't have to be, it can be intense, it can be hot yoga, or just, there's so many types. There's meditative yogas, there's anything that you focus and use your breath and move through, that's meditation, right? And as long as you control that monkey mind, that's meditation. So it doesn't have to be what the definition of, meditation used to be years ago. It's truly being in the present moment. And that decreases that stress
Mhm.
response because you're in the present moment. And it's all controlling that brain, the mind, and you're not even throwing medicine at it. It's truly lifestyle and
Yeah.
controlling yourself. And so going
So
back to
good.
like, if you're all into, yeah, if you're into that stress response and you're doing cardio all the time, increasing that stress response even more, maybe briefly just try yoga. Reset that nervous system. Try yoga. That's one. Lift weights. That's anti-inflammatory. That resets that stress response. Resistance training, right? And then if you even
Yeah.
want to, if you want to be brave and you want to go do like cold plunges, that teaches you to breathe, and that does reset your stress response. So these are just simple takeaways that you could go do today. And of course, depending on what your goal is, you could even get deeper and personalize it.
Yeah. It's so good. These are so many good tips. I know, like, for me, if I look at my week and it's very filled, stressful, instead of like going and running on the treadmill or even like lifting or anything, I will actually choose that week to do my exercise outside and just go
Mm.
for a walk in nature, because that totally calms my nervous system. I can come back and think more clearly, respond better. So I actually plan my workouts based on like the what my week looks like, so that I make sure that I have that time to reset and prepare for what's coming. So I think
I love
it's such
that.
a good point. Yeah.
Yeah.
It's super helpful. I'm curious, like, so people know, like, when people go into look for a functional medicine doctor as yourself, how would somebody find a functional medicine doctor like yourself? And then what does a typical patient journey look like in your concierge and virtual functional medicine practice? Oh, can you hear me?
Oh, okay. Yes. So to look for so functional medicine. Now, I would really look for how they practice, how their bedside manner or virtual side manner is, and see
Mhm.
how you feel, because this really is a therapeutic relationship, right? It's going to take two people to make a change. Mostly,
Mhm.
it's not, what I love about functional medicine, the right type is not the physician telling you what you need to do, what you should do, what you have to do. It's personalized in what you can do. So a good functional medicine physician will, yes, I mean, if they're certified, that's amazing. You want to make sure they have the credentials, because not everyone is a physician that's out there practicing components of functional medicine. So I would definitely
Mm.
look for experience and credentials. And of course, if the personality meshes. Now, functional medicine can get expensive. So if
Mm.
you look for, and sometimes people just want to order all the tests. My approach is slightly different. I don't just throw all the tests. I am very systematic on it. Lifestyle, do you need the test? Because they can change based off of what your lifestyle is too. So look at how they practice. Look at their approach. I think that's the best way to do it once you find them. How you find them? A lot of the times, you, of course, you can use Google search. You could do a lot of word of mouth, um, and that's the way to do it, because not all of the physicians or practitioners will use insurance-based practices, because that's limiting what you can do and truly optimize
Mhm.
people. So you won't find them with your traditional insurances too. So I would say whatever city you're in, try to find them. Um, you could see what their
Yeah.
website looks like. Set up a free consult call because a lot of them will give you a discovery call.
Mhm.
I do that too. I make sure uh, people have a chance to spend like 10 minutes, 15 minutes to talk to me and see if it's going to work out, right? Because we want to work together to achieve a goal. So you want to see how each person's approach is. I would say that's the best way to start.
Yeah, I love that. What do you see as the future of healthcare, particularly because I feel there is a rise in functional and holistic medicine starting to happen. So I'm curious, what do you think where the future will be going with that?
Yeah, I think definitely society is waking up, right? And the
Hmm.
more educated people are becoming, they want to take healthcare into their own hands. So I definitely see this going, and the pendulum is going to swing the opposite direction. Right now, if you look at it, insurance companies are running medicine. So it's a business.
Yeah.
And
Yep.
people don't want that unless of course you're actively dying, right? But the reality of it is people want to have a say and take control. They want to be inspired, they want to be empowered and motivated and have the options. They want to have the relationship. They want to have not just 5 minutes with a practitioner
Hmm.
and thrown medicine
Yeah.
and not heard and dismissed. They want to have a good at least hour to be heard, to be understood, and have a personalized approach. So definitely people are going towards that. Yeah.
Yeah. Something that is happening, at least where I live, is that, there's a community that's growing and there's not even enough physicians to see people. So that's the other problem that I'm seeing is that more people are needing healthcare. And then the physician that maybe has these patients, you're getting 5 minutes of their time because they're trying to see too many patients, I think, and like you said, the insurance companies are kind of like owning that, like creating this really so you can't have that real relationship with somebody that is supposed to help you in your health journey. So I think that there's a huge impact, and I think it will be really cool to see more people go into functional medicine. And kind of then they're going to have to open those doors, in that way as well, because I think that'll be really important to getting more access to care as well for people. And then showing people and teaching people, how to care for themselves better, I think is really key too.
Yes, absolutely.
Yeah.
Yeah.
So I'm curious too, how important is community and connection in your approach to medicine and wellness as a whole?
Yeah, it is vital because if you think
Hmm.
about it, right? Like look at the average behaviors of like 5 people around you in your life, right? The
Yeah.
impact of community is it's very influential. So that's number 1.
Hmm.
Number 2 is
Yeah.
you get the release of feel good hormones in a community. You really do. Like, look at the blue zones. I love talking about blue zones, but part of it
Yeah.
is community, right? And if you look at it, there's the feel good hormones and neurotransmitters. They're just chemical messengers, simple terms, that are released from your body, and they touch certain organs in your body and create a response, right? And so they can be good feeling emotions or bad feeling emotions. So being in a community setting embraces feeling important, feeling connection, feeling heard, but you're also motivated in pursuing those changes and doing the things that you're all going to hold each other accountable for. And
Hmm.
the other part is loneliness, right? Loneliness is
Yeah.
such a negative factor.
Yep.
And
Yep.
those that have a community and support have a healthier and happier life. So it absolutely is so important in the way I practice, which is why I love doing the workshops because it brings people together. It gets them um, in a wellness realm that hits them in a holistic way, a truly holistic way.
Yeah, that's super cool. So what inspires you and keeps you motivated to do the work that you do?
I would say there's a lot of things. I'm my passion. I'm passionate truly to help people to maintain or thrive for their wellness
Mhm.
and health. That's one. But it also goes back to being a mom. I
Yeah.
don't want to keep burning out in conventional medicine, and I don't have to be a victim mentality for that. I can make a change. And
Mm.
that ties into what motivates me as being a mom, because I want my kids to see that you could follow your passion and you could help people and follow your calling. And so with that, I get to inspire my kids, and that's what keeps me going really. It's being a mom for those boys.
Yeah, that's so good. And I totally get that. We were just talking on the call before, and it's like, you know, I it means the world to me to be doing the same, right? And to show them to go after their passion, but also not be always stressed out, in what I'm doing, that I don't get to show up for them in the way that I want to. And so I think that is so important that you recognize that and that you make a change, not only to be an example, but to show up for them in the way that you want to. And I really think that is really cool. What do you think was the biggest aspect that was causing you to burn out in conventional medicine?
That's a very good question, because I think it's multifactorial.
Yeah.
The way that not only conventional medicine is so business based, it
Mhm.
seems to focus on shareholder interests. That's just a component. And then you look at the whole system of CEOs, they're not even
Mhm.
physicians, it's CEOs that are telling the doctors what to do and how to practice. And I'm sure this is
Mm.
standard across everywhere, knowing that this is a
Yeah.
business. And here's an example: the way physicians are treated, you just have to do what they tell you to do, right? Because you're going to have repercussions if you don't, right? And
Yep.
I would say, as physicians, excuse me for being blunt, but we're probably the
I love
stupidest,
it.
smartest people, right? Because we are so divided that if you look at nurses, right? Like, y'all are so united and you have each other's back, and you guys foster and encourage having your voice heard, right? Doctors are
Mhm.
so divided that we've come so far behind that the pendulum has swung the other way that we don't really have much of a say. And I know
Mm.
society thinks, oh, they make so much money, they're so great in that. Really, that's not the case. Maybe in the olden days, but really, it's the business that's making money, and we're just
Yeah.
having to fall in line to do what they tell us to do. And so, what does that mean on a
Yep.
patient front? Well, again, it goes back to, you only have a few minutes in the room, because then you have to go run to, they have like certain rounds, right? And the rounds that they have is called
Mhm.
multidisciplinary rounds, right? This is what they have us doing, is going to corporate meetings most of the time.
Yeah.
Why is the patient still
Yep.
in the hospital? We only have this many days because then the hospital is losing money. The insurance only pays for this. Or this patient is uninsured. Why are they still in the hospital? Well, you're like, well, I'm just trying to be a doctor and do my job, and they're not ready to go home. So I'm kind of, my hands are tied, right? So
Mhm.
you're as a physician, as truly your hands are tied. And that's just
Yeah.
going down the list for like at least 20 patients that you have to deal with for that. That's a part
Yep.
of it. So I would say that all that going, the passion was sucked out, right? Because it really is, it's all corporate. It's all, then you have to worry about like paperwork,
Band-aids.
fighting with the insurance companies, explaining to them who aren't in medicine why the patient is still in the hospital. And then you have to
Mhm.
also deal with the way, I feel like COVID made this worse. Like, people have just lost their patience. So everybody is demanding, and I feel like have an unrealistic expectation of what healthcare is, what is feasible.
Mhm.
And that's not their fault, right? They just don't know. So they think that we're just sitting
Mhm.
there doing nothing, but in the background we have so much that we're getting pulled and restricted, that of course patients are getting frustrated. Of course they're not like getting heard. And then
Yeah.
on top of that, you get satisfaction surveys, which tells you how terrible of a doctor you are.
Yep.
And because of the questions that they ask aren't reflective of the type of physician you really are. It's a business.
Yep.
How satisfied
Mhm.
are you for a stay? It's become a hotel business. How
Yep.
satisfied are you for this? Did the physician take your pain seriously? And they have this down in the ER too. And I joke about it, but there's truth to it because we were just talking about this too, right?
Yes, we were.
People that are in serious, yeah, people that needs to have pain controlled, serious pain, absolutely. I empathize with that. And of course, like I would totally help
Mhm.
with that. But there's people in the system that take advantage of it. And if you combine certain opioids with certain medications, that gets you per se high. So if you throw
Mhm.
a, a a survey at them, did the physician take you seriously? Well, if we're concerned about overdosing you and killing you, then we're not going to give you that. Hence, you're going to have a
Yep.
very angry patient, angry customer.
Yep.
So it's those type of things that contribute to burnout, right? So no matter
Yep.
what you do, you may have, and I think about like the one sweet patient that's so sweet and thankful, like, thank you so much, doctor. Like, I appreciate you. The nurses here are great. Like, you have that one patient that is truly grateful, and that lights the fire in me again. But overall, it's all those factors that lead to burnout, and I know that's pretty unison across most of the healthcare workers, why we're so burnt
Yeah.
out.
Yeah, I totally agree with that and all of it. I mean, it's so true. And it's sad from like every single perspective, to be honest, right? From each perspective, because it's just a going back to the band-aid approach, right? Because at the end of the day, we don't have enough time in that hospital setting to be actually fixing the deeper issues that will really help their problem so they don't keep coming back, So it is really difficult. Well, I just really appreciate you coming on here, having a real talk about this with me, because I think that this is important. I think that people developing the awareness of it is really important so that, we can choose to take the control over our own health, and know what's out there for us. I think that's so important. So, from here, how can people connect with you and learn more about your program and what you do as well?
Sorry, that last part cut out. What was the question? Can you
I
hear me?
know our internet is not good. How can people learn more about you from here and what you do and your services?
Yes, so you can follow me on Instagram, DM me is DRREMINA, Dr. Ramina. You can go to my website. I keep it simple there too. It's www.drramina.com. And then, of course, I have a podcast show. And also, going back to either ways to contact me, we can arrange workshops if you're interested in those, and I customize that, or even taking it to keynote speaking. And I do corporate as well as just any type of event. So we can work together in many ways.
So good. I love that. Well, thank you for joining us here on Life Without Secrets and sharing your journey and all your wealth of knowledge with us. It's been so awesome.
Thank you so much for having me. It's been such a pleasure. I know we were fighting through the technical difficulties, but I think it was wonderful.
Oh, awesome. Yeah, no, I think it'll all work out. To our listeners, thank you for tuning in. We hope you found today's episode as enlightening and motivating as we did. If you enjoyed this episode, please consider subscribing, rating, and leaving a review. Stay connected with us for more inspiring stories and valuable insights. Until next time, remember, embrace your journey, take control of your health, and live life without secrets. Thanks for listening. Hey there, it's Jillian from Life Without Secrets. Ever feel like you and your partner aren't quite on the same page? Well, you're not alone, and that's exactly why I created our latest issue of Truthful magazine. It's packed with insights and stories about bridging that gap and finding a deeper connection. We're diving into real conversations about needs, feelings, and how honest dialogue can rekindle that closeness that you've been missing. Why not explore this together? Go grab your free copy right now at lifewithoutsecrets.com and turn those pages into shared moments. Can't wait for you to dive in and share your thoughts with me.